Ready? Good evening, everyone, and thank you for joining us for a continuation of our web series called Investing in You Equals Investing in God. We are so excited to have you. This month, we are going to be focusing on health and how to be healthier in our community. So tonight's topic is definitely going to be an interesting one because we are going to talk about diabetes. We titled it Not Just a Touch of Sugar, because we all remember our grandmas talking about she has a little bit of sugar, that as diabetes was no big deal. But as we've come to know, diabetes is indeed a big deal. And I wanted to give you a couple of statistics about it to really just reinforce how major our community is impacted by diabetes compared to all of the other races. For example, 4.9 million African American adults of over the age of 20 have been diagnosed or are going undiagnosed with diabetes. That's compared to 7.1% of white Americans. African Americans are 77% at a higher risk of developing diabetes. And if you look at it, we are 1.5 times more likely to be hospitalized for diabetes complications. So it's a serious thing. And we really need to start looking at that and promoting in our communities what we can do to lower these rates. And what we have with us today is Cynthia Hardy, who is going to introduce herself and give you a little bit of background about her experience and her wealth of knowledge that she has in this area. So Cynthia, we are so excited to have you. Thank you for joining us. Please introduce yourself to everyone.
Thank you, Connie. Thank you, Pilgrim Baptist Church. Thank you, Ronald, Reverend Ronald Allen. I've been a nurse probably about 45 years. I currently work for Summit Medical as a internal medicine supervisor of 10 physicians. My prior experience has been at East Orange General, which was a urban community hospital where I worked with primarily the Black community. From there, I went to St. Barnabas, where I worked in probably a more influential community, but I did see a lot of diabetes there also. So tonight, with no disclaimers to any of the jobs that I've worked for, tonight we're going to talk about diabetes and how we can manage it to have a better lifestyle. So what is diabetes? Or as Connie said, our parents used to say, sugar diabetes. It's a chronic, long-lasting health condition that affects our bodies where we can't turn food into energy. Most of the food we eat is usually broken down into sugar or glucose. That's why when you go to the doctors and they give you glucose, they take a test, they say they're doing a glucose test, then it's released into your bloodstream. When your body then releases the blood into the bloodstream, you get a signal to a small organ called the pancreas. And the pancreas is supposed to release insulin. Insulin acts like a key to let the blood sugar in your body cells to turn into energy. Okay, does anybody have any questions there? Because the pancreas is a small organ that sits between your gallbladder and your liver. So it's a very small organ that we need to function properly. So if you have diabetes, your body either does one of two things. It doesn't make enough insulin, and that's where we get diabetes type 2 from. Or you can't make any insulin at all, and that's type 1. Type 1 diabetes is usually seen in children or the juvenile. Tonight, we're going to really focus on the type 2 diabetes. Does anybody have any questions? Stop me. Connie gave us some alarming statistics that we as Black Americans have a far more incidence of
Cynthia,
diabetes.
you have a question. You have a question.
Oh, okay. I'm sorry.
It's okay. I can see them. I'm just gonna let you know when he.
Okay, go ahead.
Go ahead, ask your question. You have to unmute yourself. Go ahead.
You have to tell them who it is.
I don't know what it is. I just see T Will. Somebody on an iPhone.
Who's ever on the iPhone TWE?
I don't think they have a question. I think they're just.
Okay,
not
go
on.
ahead.
All right.
Go ahead, Sid.
All right. 34 million Americans, or 90%, have some form of diabetes. So think about the statistics that Connie gave us, that we're leading with 77% of the Black Americans to get some form of diabetes. Diabetes type 2 develops slowly. Sometimes people don't even know that they have it. It can develop over a period of time, and it can take months or sometimes even years. Usually it's diagnosed when you go into the doctor's office for another problem. You may have cut yourself, or you have a sore on you that's just not healing, and the doctor does blood work and they say, oh, you have some signs of type 2 diabetes. It goes over most people's head. Or you've gained some weight and you don't know why you've gained the weight. How does the doctor know that you have diabetes? Well, he's going to do a couple of blood tests, hopefully. He's going to do what we call a hemoglobin A1C. That's probably the best blood test to show how stable your glucose has been over a 3-month period. Then he's going to do a fasting glucose, which is in a blood test called a CMP. And then he can do, if he's smart enough, he's going to do a spot check on your urine, which is a albumin check, to see if you're spilling albumin. That's a protein in your urine. And that's important also, because that could lead to another complication if you're spilling that protein. It could mean that possibility that you could be have a form of kidney disease. Kidney disease doesn't start when you get on dialysis. There's 5 stages to kidney disease. And when you're spilling protein in the early stages of diabetes, that could be the beginning of kidney disease. The overweight, he's going to also, if your primary is doing the right job, he's going to look at your BMI. That's your index of your weight, your basal metabolic index. Now, if you're greater than 25%, we as Black people always say, well,
oh Lord, I'm done.
those charts ain't for us. Well, those charts are for us. I used to say the same thing. Those charts mean a lot to us, and we have to pay attention to it. He's going to ask you, like, how much exercise do you get? If we're not, and we're not talking about beating the, going and doing all this Peloton stuff. Are you walking 30 minutes at least 3 to 4 times a day? Are you, are you driving your car everywhere you have to go, even if you needed to walk down the street? Do you, at lunchtime, if you could walk, if you're on the premise of your job where you could walk around, do you walk around? That's important. So these are the things that a good primary doctor should be asking you. Some other pre-diabetic. Before you get to be a diabetic, the doctor may say, you know what, Cynthia, you're pre-diabetic. What does that mean to me, a pre-diabetic? I'm borderline. Well, doc, what's borderline? Again, he uses that hemoglobin A1C. If you're greater than 5.7, then you're going to fall into that pre-diabetic stage. Again, they're going to use, he uses that to look at how stable has your glucose been over a 3-month period. If it's greater than that, 5.7, he's going to tell you, you need to do some lifestyle changes. He's also going to look at your blood glucose again. A normal is 99. When you start seeing someone in the diabetes or pre-diabetes, you're usually running somewheres 110 to 120, 129, and that's a pre-diabetic. We mostly would say, oh, I ate, I drank a little something before I came. No, we make up every excuse that we can to say we don't fall into those categories. And that's okay. We need to realize that what we can do to change while we're in that pre-diabetic stage. Type 2, how are you using the insulin that you do have? Your body still has some insulin, but you're not responding the way you should. Once your doctor identifies you as that pre-diabetic or that you're a diabetic, the patient should be given and allowed to make a healthy change in their lifestyle. Well, Cynthia, how can you make a healthy change in your lifestyle? There's lots of ways to do it. It's what we eat. How many of us would rather pick up some food from a fast food place rather than decide to make our lunch and take our lunch to work with us? Dietary change is one of the biggest things that you can do to change your lifestyle. Decreasing the types of carbohydrates you eat. Now, if you all realize, carbohydrates are in everything we eat. You can have, is there anyone that can name just 3 carbohydrates that you think that we shouldn't eat or we should eat less of?
Potatoes, bread, and juices.
Rice. Where's Jenny at? Jenny's favorite.
White rice, white bread, and overripe fruit or bananas, because they're more apt to turn into sugar quicker than if you were to eat a hard apple or if you were to eat a banana that's less ripened. So when we see a patient who's pre-diabetic, we have what we call a glycemic index guide to give them. On this simple chart that you'd be amazed, we have a green light, a yellow light, and a red light. On the green light, these are foods that are low in glycemic index, meaning that you could eat most of them all the time. The yellow are cautious foods that you should eat sometimes. And the red, you need to stop and think, can I replace that with something else? Think of a dinner plate. And if you were to cross that in half, the top being vegetables, and on one side you would have grains and starches. On the bottom, on the other side, that you would eat meats and an alternative. Think of that and think of how if you did that every day, probably in a week's time, you will start to decrease your eating habit, decreasing your stomach and the way you eat. And before you know it, you will start shrinking, you'll lose inches, you'll start losing weight. The best way to lose weight is 1 to 2 pounds in a week's time. And that's the motto that Weight Watchers goes on. So some of the low glycemic index foods are a heavy mixed grain bread. So pumpernickel, your rye, your spelt breads, sourdough breads, a whole grain bread, even your cereals, all bran, your bran buds, your grains, your barleys, your beans, your pasta. When you cook a pasta, think of cooking it al dente. Don't cook it until it's almost dead, and you gotta pour water over it. Your pulse flours, your quinoa, your converted rice or parboiled rices, peas, popcorn, sweet potatoes, and winter squash are your low glycemic index foods. Your mediums are your flaxseed, pita bread, pumpernickel bread, stone grains, cream of wheat, oatmeal, oats, basmati rice, couscous, beets, corns, and believe it or not, French fries that you can cook without grease, all right? Red potatoes, crisp crackers, and then your high glycemic index, things that you don't want, like we said before, the white breads, your all bran cereals, corn flakes, puff wheats, Special K, Rice Krispies, jasmine rice, carrots, all the things we like, mashed potatoes, pretzels, rice cakes. And if we look, we could probably get some other things. And then there's apples. So I will make sure that you guys get a copy of this. People are big on almond milk. Those are good things now in the low glycemic index. High would be rice milk. Talk about dividing the plate. That's a good way to think of when you're filling your plate for dinner, what you put on your plate and how much you put. You could eat as many vegetables as you want, and you would find out that you're doing okay. So when you're looking on your labels, if you look at the grams of carbs, anything that's 15 grams or less is a good carb, because you want to stick to maybe a carb per meal. You want to look at sticking to probably about, I would say, 40 carbs a meal. And when you think of that, it's a lot of carbs that you're eating. And that's a good way to think about trying to lose weight. Decrease eating your fried foods, because along with diabetes, other issues come, high cholesterol. And I'm not going to hit on that because I know that you're going to have someone talk about cardiovascular and diabetes, cardiovascular, all mixed together. So diabetes is a state that crosses over many barriers of medical issues. I'm just going to touch briefly on medications. Medications when you're pre-diabetic, there's metformin. Metformin, when that drug came out, was like a wonder drug. Metformin does a lot of things. It helps with weight loss, but it also helps to control and also helps to produce the insulin out of the pancreas. So it helps to control the sugar, when it turns into glucose and to give you energy. So it's a very good drug to use. A lot of people say, well, let me try to get to this healthy lifestyle myself. And that's a good thing. And most doctors will allow you to do that. I say, and I tell everyone, once you're pre-diabetic, just like you wouldn't go get your hair done by someone who does nails, don't let your primary care doctor be the one to tell you how to take care of your diabetes. I think everybody, whatever stage you're in, you need an endocrinologist. You need that specialist who will tell you exactly what you need. There are newer drugs out that are also great drugs when you're pre-diabetic, and even when you're a diabetic type 2. You have the Victoza, you might have heard of these, the Jardians, the Invoca, the Byettas, that help you to lose weight, but also stimulate the insulin from the pancreas. So those are
have a
good
que-
drugs that you
We have a
usually,
question, Sam.
okay.
Go ahead. Go ahead, Alice.
Oh, I'm going to wait until she finishes and ask my question.
Okay.
We're good.
Those are drugs that are usually prescribed by an endocrinologist, and they work very well. They work very well to help stimulate the pancreas to produce the insulin, but they also help you with weight loss. And they're very good. They've been known to work well, but again, they come from an endocrinologist. So having a primary care, what are other things that you need to do to specialize, even if you're pre-diabetic? You need to make sure that you are getting your eyes checked at least once a year. Why are you getting your eyes checked? When you become a diabetic or pre-diabetic, you also might have a problem where you're having bleeding in the retina. And you don't know that. And most people don't know that until one day they wake up and they have a blurriness. It's so important to go to an ophthalmologist. Don't go to just like these eye care places like Vision Center. Go to a true ophthalmologist to get your eyes checked. The other thing is a podiatrist. It's so important to go to a podiatrist at least quarterly to make sure that they're inspecting your feet, to make sure that you don't have calluses, to make sure that they're trimming your toenails. Because once you go and somebody trims your toenails, that starts the whole realm of, you hear people say, oh, they're going to cut my feet off. They're going to cut my toes off. That's because you haven't cared for your feet in the way that you're supposed to. Don't wear shoes that you're not supposed to wear. Take care of your feet because it's most important. You're making sure that your blood pressure is controlled and making sure, again, that your cholesterol is checked. Blood pressure control is another barrier and aspect of healthcare that goes along with diabetes as cholesterol. And like I said, I'm not going to touch on that because I know that your next speaker will do a great job. So the takeaways. Diabetes is a lifestyle change, condition that requires careful blood sugar management and healthy lifestyles for people who are able to manage it correctly. There are several different types of disease. We talked about type 1, just very little, but type 2, it's so important. You don't even have to get to type 2 if you can control yourself and take care of yourself when you're told that you're a pre-diabetic. Make sure that you're not consuming an excess of high carbohydrate foods because it's going to fluctuate your blood sugar. And that when you start doing that, then your pancreas is not going to be able to sustain the insulin that you're already making. Uh, Complications of diabetes can be severe. So my point to you is that the more that you take care of yourself earlier, then hopefully you're not going to go away having complications. Diabetes can lead to so many things, the amputations. It could lead, I think it's the leading cause. At one point, hypertension was the leading cause to renal failure. At this point now, it's diabetes is one of the leading causes to chronic renal failure. Make sure you continue to think about, and even if you don't have diabetes, eating a diet high in nutritious foods, including whole grain fruits, vegetables, lean proteins, fish, even the white pork is good, low dairy products, and healthy fat sources. So we do need some fat sources, olive oil when you can, canola oil, and nuts. Refrain from drinking excessive amounts of alcohol, or keeping intake or to less than, if you have to drink, for women, 1 drink a day, for men, 2 drinks a day. Encouraging at least 30 minutes of exercise a day, and at least 5 days a week of some type of a walking, aerobics, riding a bike, or swimming. You can live with diabetes. We can change our lifestyle. And I like what Connie said in the beginning. We have to change our neighborhoods. We have to change our attitudes about it, whether it's through our churches, our schools. We have to change what we do to prevent further damage to our society. So if anybody has any questions, I'd be
Ben, I have a
willing.
couple of questions of things you hit on, but I just want to drill into them a little bit more. So when we're talking about recognizing the signs of diabetes, because you said most people don't even realize they have it. So can you go over what are a couple of signs that we should be
So
looking
some signs of diabetes, you could have increased thirst, you could have frequent urination, extreme tiredness, increased hunger. Some people have weight loss, and then there are other people who increase their food intake, so they have weight gain. You have that lack of energy. Sometimes you'll have blurred vision. You'll have frequent infections. So you get rid of a cold, and then another week or so, you have a cold again. You have a sore throat, you get a sore throat again. You have a urinary tract infection, you get it back again. I think I talked about a cut that won't heal. And, you finally decide, okay, I'm going to go to the doctor. So those are some classic signs.
Okay.
All right, so Alice had her hand, and then Ronald, and I think Marie.
Hi, good evening, everyone. Good evening, Cynthia. Very, very informative information. I have 2 questions. The first is, a lot of people will say, oh, my mother had diabetes. Oh, I'm going to get diabetes. What is to that myth? How would you address that?
Hereditary does play a big part in it, but I think that our lifestyles, we know a little bit more. We have better health care than some of our parents. That our food choices are a little bit different than what how our parents ate before. So we have choices of foods that they didn't have choices for, even though they had farms that grew great vegetables and stuff. But on the other hand, they had pork that they cured themselves. So all of those things play into what their family history was, which gives it to us. So I think we can make the changes. We can do different things to prevent.
Okay,
So
my second
some of
question
that
is,
is true. Mhm.
okay, my second question is, how does diabetes affect your heart?
Well, diabetes affects your heart through the cardiovascular. You, because you can build up plaque, which there again is the high cholesterol. And I didn't touch on that, but sometimes people don't know that they have high cholesterol and the statin, they don't take the statin. Then the next thing you know that they, may start with peripheral vascular problems, which lead to clogged arteries, which goes to they need a stent. It's many different ways. Hypertension, they may have hypertension and they don't keep they may be taking pills, but their blood pressure is not controlled.
Okay. So in your opinion, you talk about life changes. Even though we may be predestined from our heritage, we can change it by how we live. So
Exactly.
if you're a diabetic, do you suggest eating sugars and drinking sodas? I know for a fact you don't believe in drinking soda.
But no, no, we should drink more water. We should drink, change our lifestyle. So if you're, as I said before, if you do drink, not drink 4 drinks a day. If you're a woman, maybe 1 drink. And if you're a man, instead of drinking 5 drinks, you're going to drink 2 a drink. So you're going to change your lifestyle, and maybe you'll drink even less than that.
Okay, thank you.
Okay. Okay. I think Marie
you had a question? Okay.
Yes.
Yeah, Ronald does.
Oh, okay.
So my question has to do more with, I guess, age and how, we have looked at, especially in the Black community, a lot of people look at it as it's mostly our older generation that are having issues with diabetes and having issues with things like that. What do you say to, people in early 30s and younger who are very much looking at, these types of situations as, well, that's not something I have to deal with now or I have to worry about, where there's a mentality of excess with food, with drinking, with, things like that, as well as not necessarily going to the doctor as often because, when you're younger, hey, I feel great. There's nothing that I see going on. What do we say to, those of us, that might be either have children of a younger age who aren't keeping things like that and checking it out, or, we are personally, like I'm 35. I've never really thought about, hey, maybe I should make sure I don't carry any of these symptoms or things like that until listening to some of the things you said. What do we say to, that generation that feels like, hey, I've got time before I have to deal with that?
Well, I think about it. When you have children, you made sure that you took your babies to the doctors when they were 3 months, when they were 6 months, a year, and you made sure that they went every year to get checkups. I think in vain, that should be continued. That should be continued with yourself, with what you do. And some of the things like, don't be complacent. When your doctor says, oh, all your blood work was fine, blah, blah, blah. Can I have a copy of that? So maybe you heard what he says, but you didn't hear. You bring that copy home. You have enough people that you could say, can you go over this and look at it? Do you think that what the doctor said to me was fine? Or do I need something else done? And I think everybody has somebody. Don't let things, I think we lie to ourselves. Even, I'll tell you, as healthcare professionals, we see them and they are probably some of the worst. They let things get out of control before, they're going to come to a doctor. And they have healthcare insurance. Make sure that even when you feel good, go to the doctor. That's the best time to go to the doctor because you have a baseline of feeling good. So when something goes wrong, they can say, I know that this, and this have been checked out and it's fine. What I didn't mention is because children now, teenagers have sedentary lifestyles because of their Xboxes of whatever they are. We're seeing more kids with diabetes than we've ever seen before because they don't go out and play. You know, a 15-year-old sits in the front of the Xbox all day long and just snacks and snacks and snacks and snacks. Whereas when you were 15 or 14 or younger, you were outside playing on a good day like that today. I don't know how many people took advantage of the weather today, but it was a good day to go out and just to go out and play, you know, for kids, not us who had to work. But I did go out and I took a walk on the grounds because it was hot inside of the building. So I just said, let me go out and take a walk. But how many people take advantage of that? You know, so go to the doctors when you feel okay. And then if something is wrong, they'll have a baseline for you because we do it for our children.
Good. Yeah.
Or we did it for our kids.
This is Marie, and
Yes,
then Brother Poole.
okay. My question is, you had mentioned about the endo, and my PCP and my cardiologist are the ones who basically tell me and control the diabetes thing by telling me things to do and what to eat and what not to eat and all about the exercise and whatnot. I'm not a diabetic yet. I mean, it runs on both sides of my family history and really, really, really bad because I have a nephew who lost his eye behind diabetes, one of his eyes, and his kidneys both went bad. And he had to get a transplant, and it's been 4 years now, and he's still surviving. Based on what you're saying, right now, it seems like again, I'm not really pre yet, but I'm in the pre category. So, is there a reason for me to go see an endo yet?
I think
both
you
of them are
should.
handling it.
Yeah, I think you should. And I think because of your family history, it's nothing wrong with them to refer you to a nephrologist just to look at your kidneys, for them to say, your kidneys are fine, come back and see me in a year. So somebody keeps an eye on them. There's nothing wrong with that. And a good doctor would say, yeah, there's no problem with that. You don't want them to go bad and then say, oh, let me send you to a nephrologist, or let me send you to an endocrinologist now.
Mhm.
Go while you're good, because he may change something that your cardiologist, who the cardiologist takes care of the heart. The primary is just a gatekeeper. So he should be sending you out, especially knowing your family history.
Mm-hmm. Okay, so I have to talk to him about that.
Yeah, just tell him, I'd like a referral to a endocrinologist. Who are you with? Atlantic Health? Are you with?
Yes, I'm under Atlantic Health.
Yeah, so there's some good endocrinologists and nephrologists with them.
Oh, okay. All right.
Yeah, and tell them, they can't say no. So then say, okay, well, I'll pick one and I'm going. So then what are they gonna say?
Yeah, because I wouldn't need a referral, so I could do what I want. Yeah.
Oh, well, then if you can do what you want, then I'd be gone.
Okay, thank you.
Okay.
Good evening, everyone.
Oh, hi, Mr. Paul.
Hey, Warren.
Okay, please, you can call me Warren, Cynthia. Well, I want to thank you for being on this evening. Thank everyone at Pilgrim Baptist, and God most of all. I'm already diagnosed. I was diagnosed with diabetes 9 years ago.
Mhm.
And right now, due to the pandemic, when everything was shut down last spring, I had gained an enormous amount of weight. I was on Metformin, still on Metformin.
Mhm.
And it was twice a day, and it was cut down to once a day, but I'm also on insulin now, Ozempic, once a week. And I have lost down I have lost down from the 260. Right now, I'm down to 218. I was put on the Ozempic in September, and has helped cut my appetite, and it has helped with, I've really been trying to change my diet. So right now I'm down to 218. And I was told if I get to at least 200, that maybe I could come off the metformin and the insulin altogether. Now, my question is, I have some other health issues as well. And I don't actually see an endocrinologist. They have there she's called a diabetes specialist. And I see her, but for the most part, again, like Marie was saying, it is another specialist that I see and the heart doctor that keeps tabs on it. The diabetes specialist there doesn't, she can't prescribe medicine. She will refer back to one of those two doctors. The other two doctors has what is needed or what she sees is needed. You know, and my insurance lets me see her like twice a year.
But she's a dietitian, so she's really a nutritionist. The dietary specialist is a nutritionist. So, but the endocrinologist, I mean, they have you on some of the right medications, but an endocrinologist may change some of that around to help you get off of that, off of the insulin. What is your hemoglobin A1C? What was the last
To be
one?
honest, I have so many numbers in my head that I don't remember, to be honest. You know, numbers for this issue, that issue, numbers I have to keep in my head for work. I usually get a copy of my blood work every time I go in for lab work. So they usually tell it's good or if it's not good, and I usually read it myself as well. But right now, to be honest, I couldn't tell you my numbers. I just know, like last month when I went to the doctors, they were like, everything's going great, you're doing well. I want to say it was either 6 or 7. And
you know, when they say a 7, I think a good for a pre-diabetic would be down to 6. And then they can say it's good. A 7 is still high, but if it was like, if you started out and it was like 9 or something, yeah, 7 is good. But you still want to keep pushing it to go down.
Yeah, it was up past 7 before. I want to say it was like a 9. Maybe a 9, possibly 10. It was very high. And most of it was contributed to the lockdown last spring. Because when I stress, I cook. And because when I cook, normally I would give the food away because there was nobody to really give it to. I found myself eating.
Oh, okay.
So, for right now, I just want to say I'm good. You said something about seeing the eye doctor and the dentist.
Yes, eye doctor, dentist, podiatrist, and also they should refer you to a nephrologist just to check your kidneys out. You don't have to have something wrong with them. You don't want anything wrong with them, but you want to get a baseline to make sure that they're still functioning like they should function. They should do
They do. They send me to the kidney doctor, as well as they check my liver. The liver, the kidneys, and the pancreas are the 3 of the most things that they check on me almost at least 4 times a year.
Because you're on the Ozempic, so they need to check the liver. Yeah.
And also, you talked about trimming your nails. I found that the doctor that I go to, when they send me to the doctor, I guess he's an endocrinologist, to trim my nails, didn't do as good a job as the nail shops do. Be it my fingers or my toes. I don't know if he had this fear of touching, but he like barely touches and barely clips, and it's like, okay, you're good. He puts on 3 or 4 pairs of gloves, and he touches and he says, okay, you're good. And to me, I feel uncomfortable with it. And
find another one.
So right now, St. Michael's is where I'm at. And St. Michael's, because I am employed there are pretty
Oh.
much pushing with the new people there. Everything needs to be in-house.
Oh, okay.
You know, you have to really give them a reason as to why you want to go to somewhere out of St. Michael's.
Okay.
So, you know, it's a little difficult to actually just change. But what I have been doing anyway, I was like, I really started going to the nail salon. And what I actually wind up telling them is like, I'm diabetic, so don't cut or trim too deep.
Okay.
And most of the time they say, okay, we understand. But, you know, I was just curious about how safe am I going to them?
Not safe at all. For a diabetic, pre-diabetic, not safe.
Okay.
So, Warren, you might have to tell on the person who does them at the work that he's not doing a good job. You might have to report him.
Yeah.
Tell on him.
Can Cynthia, can you talk a little bit more about hypertension? I think that's a big issue that sometimes we miss along with that, with, you know, the diabetes, if you will, just a few minutes, and then we'll go back to any questions anybody have.
Well, with hypertension, I think the goal was changed probably 3 years ago. People were thinking, oh, if I'm 120 over 80, I'm good. But they changed the standards that the systolic needs to be lower than, and the systolic is the high number, needs to be lower than 120, and the diastolic less than 80. And, you know, I know myself, I had to juggle my meds around until I met that number to get it lower than that. And also the weight plays an important part in that, making sure that I you know, your weight is important. But if you're diabetic and you have high blood pressure, and you know, all of that is so important to make sure that it's being cared for. So people, because if you have high blood pressure, we talked about the bleeding in the eyes. That can cause your eyes to bleed. That can cause you to have a stroke. It can cause you, and it throws off the diabetes also. Stress throws off the diabetes. People don't understand that. Just the slightest little thing of not in control, it's going to throw off the diabetes. And you know, hypertension is a part of the cardiovascular system. And it means with diabetes, your peripheral vascular, the blood flow. So if you don't have good blood flow to your heart, you're not going to have good blood flow to your lower extremities. So.
Cynthia, you just mentioned the dentist. How does that tie into the diabetes and the teeth care? How does that tie together?
So if you say you have a cavity and you don't know that, you're putting extra stress on the diabetes. So you're causing you got an infection. That cavity can be infected. So you're making that insulin that you do produce work harder. And you need to get on, you know, you need to get on a antibiotic to get that infection cleared up so that they can fill the filling or whatever.
So I think a big message that I'm hearing you say is that prevention is much better than the actual disease that we've been talking about. Taking better care of ourselves, eating better, exercising, not eating the wrong things, but most importantly, and I think Darlene mentioned that in our chat there, to know your numbers, to make sure that you understand, you know, what those numbers mean. It's a lot of information out there. So if you're not sure, ask somebody. I totally agree with that.
Work and yeah, because to me, for a doctor to say, oh, everything's well, I know what we do in our practice. That's not what we do. We make it very clear. We're calling patients, we're telling them, look, this number isn't where it should be. We break it down for them. Plus they have their portal and it's spelled out for them. And on an average day, we get 150 portal messages from patients. Because if they see anything, little thing off, they're going to call and say, oh, well, what's this? So don't be afraid to ask your doctor, because that's what they're getting paid for. That's what all I'm saying. Don't be afraid to ask them. You know what? That's what they're there for.
Absolutely.
Yeah.
So we do have, I'm going to share, Cynthia's going to give us the information that she has as well. We do have a short film that I'm going to attach to our information that we share with everyone today. It's called A Touch of Sugar. You may remember it came out a couple of years ago. It's for Viola Davis. She filmed it. And basically what it talks about is how, as African Americans or people of color, how these types of diseases are affecting our communities, and how it's so important for us to take care of ourselves and to do better about the types of foods we eat, exercising, and doing what we can to prevent ourselves from getting into those pre-diabetic stages. So I'll definitely share that with everybody as well. It's like 9 minutes. It's 9 minutes to watch it.
Cynthia,
Any
I
more
have a
questions?
question.
Oh, hey.
Okay.
I have a question for you. I've been a diabetic for 23 years. In 2007, I had major surgery, 50,000-mile tune-up, and came out pretty.
Mhm.
Took me a while to get over that. So when I came out of recovery, they were injecting me with insulin. I was not on any insulin before the surgery, but when I was coming out, they were saying, her sugar is high, you know, and I just remembered that happening. And then my son said, okay, she's not eating anything. You got a drip there. What's in it? And they said sugar water. So I learned that hospitals will even give a diabetic sugar water, which is going to run your sugar way up, where they can give you regular saline. My question to you, so I got in trouble with my kidneys. I was being swollen if I inject myself in the arm, because my doctor said, oh, you need to take this insulin. I was swelling my arm, my neck, everything. And I kept saying to her, something is wrong. Something isn't right. But she says, I never will forget the day I went, because I kept calling her and saying, something isn't right. She said to me, well, I'm going to choose another insulin for you. And I got in my car and thought, no, you won't. I went to a place in Massachusetts that God sent me to. My kidneys were in trouble. But because of the insulin. I was never having problems with my kidneys before that. The blood work wasn't showing that. So I didn't tell my doctor I was going. I went because I was led spiritually to go. I can honestly say to you today, I haven't had insulin in 10 years, whatever. I got to this place in Massachusetts, Black people who are Adventists, they don't eat meat, they don't eat this, they clean you out. I got there on a Sunday, they took me off insulin on a Monday. I have blood work to show that my kidneys are working at 100% now. My doctor said to me, how's your insulin when I went back? And I said, well, I don't take it anymore. And she says, what do you mean? I said, I went to the Voice in the Wilderness Mission and they took me off. She goes, well, that's malpractice. I said, it's malpractice. You've given people insulin. We were toe to toe. She did not like that I had been restored by God. And she was like, you should have stayed. I said, well, look at my blood work. She was like, well, your blood work looks okay, but if it doesn't get better, here's my issue. Have you connected insulin to dialysis at all? Because my kidneys were, the numbers, whatever it was.
Right. I think when you had surgery, they put you into acute failure. That's what happened to you. You got put into acute failure. And whoever was taking care of you didn't know what they were doing. So I think you were put into acute failure. And had they did the right thing, they probably could have brought you out without giving you all that insulin. You know,
because it was the craziest thing ever. I mean, I didn't even understand what was going on, but here's my thing. I think mainstream doctors are fine, but they give you chemical after chemical after chemical with such side effects. And I think as a diabetic for 23 years, we have to be advocates for ourselves as well and try to make sure. So I go to a nephrologist and I'm saying, so I don't know how did my numbers get like this? And he says to me, well, you're in stage something with your kidneys. I said, that is so bizarre. I never had kidney problems. I said, so what do I need to do? He says, well, I really don't know. He said, you don't know what I needed to do. Well, I just started looking at, I was always I'm not a foodie, but my thing was processed food. You got to be careful eating all this stuff. Look at your urine when you urinate and see what's going on. Real critical. But I just took matters into my own hands. And my attitude with diabetes is I eat my friends, not my enemies.
Mm-hmm.
My doctor said I'm the only patient who says that to her. I eat my friends, I don't hang out with them. And I just think that we have to really, really be advocates for ourselves. And learned I was allergic to insulin as I was to birth control pills. I can't take hormone type stuff.
Yeah.
I learned that.
It's probably what you were allergic to. And I know some other people that were allergic to pork insulin.
Wow.
You probably needed beef insulin. And they probably didn't want to pay for it.
I gave it back to them. But also another attitude I have is it's on both sides of my family. And because of genetics, I think it loads the gun. But we need to know what we put in our mouth pulls the trigger.
Mm-hmm.
That is and that's how I see it.
Yeah, no, that's true. I know the patients we care for, we give them the opportunity. We don't start them on medication. We give them the opportunity to change their lifestyle.
That's great.
And most of them do well because they want to change, because people don't want to take pill after pill, but there's some pill poppers out there now that want to take. But for the most part, most people don't want to take pills and they do want to change their lifestyle.
Yeah, but I thank you. I connect somehow. I was in bad shape. And doctor really wasn't helping me in it.
No.
God did.
Okay, so a couple people put some comments in the boxes in the chat. If you want to say something, we're headed towards our close. Again, another topic that is something that we need to, again, later on in the year, come back and look at it. I think great comment, as Sharon said with Darlene, everybody should go to their doctor. Now that's the first thing. You need to have a doctor that you can go to, and you need to be able to trust your doctor, that your doctor is going to act in your best interest. One of the things I always tell people, my particular primary doctor never rushes me out the office, never rushes in, never whatever, wants to sit and talk and go over everything. You go to a doctor and they're rushing in and they got but 5 minutes for you. You need to make sure you have the right doctor. And then when you're, if you can go out on your own, your insurance allows you, or your referral, you need to make sure that those doctors understand that you're going to double check what's going on. So I think it's an important factor that the doctors that we go and see are doctors that are looking out for our best interests. And the other part of it is that when the doctor gives you, you should ask the doctor for a copy of whatever test they do on you, so you can have them if you ever need to refer to them. If you leave that doctor dies, you should have that information in order to take it with you wherever you go, and to know what your numbers are and all of that kind of stuff. Some places have the portals that you can go in and get your information, but you ought to know what it is, and you ought to stay on top of what goes on. If your insurance allows it, once a year, twice a year, go in and get those tests done, all of that stuff. And hopefully your doctor's going to sit down and talk to you, and or if you got any and all specialists or whatever it is, that they're going to do that. So before we close out, is there any other questions that anybody has? Okay, so again,
Yes, just one question.
Sure.
Cynthia, I would like your information for you to do a presentation, this same presentation for the clinic. What I do there a lot of is reaching out for resources, and this is definitely a resource that can be used there at the clinic. Basically for the patients, probably some of the staff, but hopefully one day next month. So Sister Sharon or either Reverend Allen or Connie can give you my phone number.
Okay.
And I would greatly appreciate setting up some time with you because we're looking at doing comorbidities as well for you along with it.
Okay.
Well, we appreciate Cynthia coming on. I know in our family, if there's something going on, we call her up. We call her Dr. Cynthia, and she hasn't led any of us in the wrong direction. We're grateful that she could come and spend time with us. And again, our moderator for being on here. In 2 weeks, we'll be back, and we are going to have someone that's going to be talking about the heart and talking about all of those different things. We, as Reverend Dean said, we need to get serious about this. We have to change our own course of our lives and everything. So, we're going to get Alice, who deals in insurance, and she's going to come on, do a presentation for us, talk about, there's a variation of insurances out there. Everybody needs insurance. One of the things, and you all probably have come across it, younger generations, they want to go to GoFundMe to raise money to bury somebody. But I think that we need to change the course of how we look at these things, and insurance is a big thing for us to understand, and then for us to move the next generation into and understand it. I as a kid coming up, my mother, it was $10, but she paid that $10 every month. If something happened to one of us, at least she said she could bury us. If it's not, we always were able to go to the doctor and that kind of stuff. So again, I thank all of you for coming on. Again, we're going to be back at this. I'm determined that we're going to continue to work out what's going to be best for our community. And hopefully we can get more people involved, more people to join in on the sessions. And there are a number of professionals out there that we're going to continue to reach out for and get them into our webinar sessions so we can give that information out, not only to our congregation, but to anybody that wants to come on and be part of it. So again, with that, thank you so much, Cynthia, for coming on. Thank you, Connie, for being our moderator, and to my wife for being the technical person behind all of this. Connie, I turn it back over to you.
Thank you, everyone. And as Pastor mentioned, please put on your calendars to join us on the 23rd for our session that will talk about hypertension, the silent killer, and its impacts on heart disease. So that should also be a very interesting topic, because as Cynthia is saying, that was at one point the highest killer of our community, but diabetes has surpassed that. But that's number 2. So that's another thing we need to get under control. So please share when we put out the event. Please share it with your friends, and we'll see you again in 2 weeks. Thanks, everyone.
Thank you.
Okay,
Thank you.
bye-bye. Bye.
I apologize for being late, but I was calling parents. I wasn't grading papers this time. So Ms. Connie, how do you go about getting the